Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hey y'all, I'm Portia Wofford-Terry, also known as The Right Nurse. I'm a nurse, a writer, and a health equity and diversity advocate, and I'm here with my friend Sarah.
Hi everyone, thank you so much for having me. Excited to be on the Nurse.org podcast with Portia. We wanted to bring you an episode that talks about the things that nurses like to tiptoe around when it comes to navigating complex encounters in healthcare, talking about nurses, patients, and criminalization of care. When this podcast is being recorded, we are in the middle of a tense election cycle, and we are hyper aware of the ways that not only this election, but policies and the criminalization of care impacts our patients, and how increasingly we are seeing this happen in our care settings, but also acknowledging that police violence impacts our patients in our communities and how we face this and witness this in care settings. This episode will focus on the intersection of public health, racial equity, and the role of nurses in interacting with community partners to address systemic issues. Now, the reason that Portia and I really wanted to get on this podcast together, and we have been working on this episode for the last few months, is in the wake of the killing by law enforcement of a Black mother named Sonia Massey. She was 36 years old, and according to CNN, she was killed on July 6th after two Sangamon County Sheriff's deputies responded to her 911 call about a possible prowler at her home. Sonia asked for help and was killed by one of the deputies who responded to her 911 call. So we wanted to really explore how nurses can contribute to creating safer and more equitable communities by collaborating with community organizers to ensure that responses to public health emergencies, and particularly in marginalized communities, are just and effective. And this is very relevant to me as someone who helped start a peer support program for healthcare workers. We have been told to use 988 as a resource for our colleagues and for the community, but I hesitate to promote 988 as a resource because 988 as a resource can deploy police to people's homes. So we try to provide informed consent by saying, hey, if you do call 988, it is possible for police to enter your home. It is possible that police will be deployed to care for you, and I can't guarantee that you're going to be safe in that encounter. So instead, we like to share the crisis text line, which is 741-741, which matches folks with a crisis counselor and then directs them to specific resources that are local to their area. It's just a really tense topic, and we wanted to say something, talk about this, but also talk about the nurse's role in our responsibility, not only to advocate in our care settings, but also for our communities, and trying to really highlight how we can push back against repression and also violence in our communities. So Portia, would love your thoughts as well on this.
Yeah, as someone who has struggled with my mental health, in 2022, I went through a mental health crisis, and luckily Sarah was one of those people who I was able to reach out to. But as a nurse, I now have a different perspective. I now can see why people are hesitant to seek help, because I am a nurse. I knew all the resources. I knew all the tools available. I knew how to navigate the healthcare system or the mental health care system. But when you're not in the right state of mind mentally, when you're not who you are and you're in a mental health crisis, then it's scary. And I went through that, and I was scared. Even though I had Sarah, who's a nurse who advocates for mental health, I have other friends who are nurses and nurse practitioners who advocate for mental health. I still was at a point to where I was scared to even go out and seek help. And as a nurse, it made me more empathetic. I have a lot more empathy for people who are struggling with their mental health, because I know what it feels like to think, if I go here, if I go to the emergency room, if I seek help, then what's going to happen to me? Are they going to, involuntarily commit me? Is this going to affect my nursing license? Is this going to affect my livelihood? So I understand, how you can be in a point to where you just don't know what to do. And I think a lot of nurses, we want to help our patients. We want to be able to help them navigate those situations, but it comes times where we don't know what to do. So I think this is a very important topic. I think, having organizations like Don't Clock Out, Debriefing the Front Lines, or organizations that are geared towards healthcare worker mental health. And those are, resources that we can have not only to help ourselves, but get some tools and resources to help our patients as well.
And Portia, thank you for being so vulnerable about your own story. I think that we often don't consider that healthcare workers can have mental health crises as well. And in your case, like, you were very vulnerable, and the last thing you wanted, I'm sure, was for police to come to your home, right? Because you were in a vulnerable state, a vulnerable position, and who knows what would have happened. And again, that also was a barrier to you seeking help in the emergency room, because you felt like you might have been policed by the nursing staff or the physicians and then involuntarily committed. So you reached out instead to people that you could trust. It's an indicator that we need more than police responding to mental health crises. We need people who are integrated in our communities, who we can trust, who aren't going to immediately assume that we are here to harm others or harm ourselves. And instead, folks that can de-escalate, folks that can give us access to the things we need to be safe, instead of potentially putting folks who are at risk into an even more harmful scenario. So, when it comes to the nurse's role of patient advocacy, when we talk about interacting with police, the primary role for nurses when it comes to interacting with police is focusing on the patient. We should not be siding with police immediately when it comes to what our patients need, because that is not in their scope of practice, right? And we are that first line of defense for our patients, especially when they are incapacitated. And this duty aligns with hospital policies, our nursing code of ethics, and the rights that our patients have in care settings. And one of the examples that nurses are particularly familiar with is the Alex Wubbels case. We might remember Nurse Alex Wubbels, who made global headlines for refusing to allow a police officer to take a blood sample from an unconscious patient without consent or a warrant. She was violently arrested. I'm sure every nurse that's listening can remember that video. This video and also her experience can serve as a case study on patient advocacy, even in the face of authority when it violates patient rights and hospital protocol. So there are legal boundaries regarding police interactions in hospitals, and nurses might be asked to comply with law enforcement requests that contradict patient safety, privacy, or hospital policies. Portia, have you ever had an experience in a care setting where you had to deal with something like this?
I have not had an experience where I have had to deal with police per se, but I have had an experience where I have had to let another nurse know, you're not here to police the patient. That is not, in your scope. And we have to also, I think it's fair to point out that the police don't understand our scope as well. And so, we're not here to police our patients. We're not here to judge our patients. We are here to take care of our patients within our scope of practice that our state license requires us to do so. And so I have had incidences where I've had to, I worked in a facility where we took care of a lot of patients who came out of the prison system. And I've had to tell the nurses, don't, go try to look to find their record, like it's a HIPAA violation. Like we're here to take care of them. We have the information that we need to take care of them. And so we're, like you said, Sarah, it's not our role. It's not our duty. I think a lot of nurses get that misconstrued. It's not our duty to police our patients. It's our duty to take care of them in a safe and effective manner. And that's safety for us as well as safety for our patients. And I think it's also important that, this is where the nursing code of ethics and also what your hospital policy comes into effect. Understanding and knowing your code of ethics, understanding and knowing your state board scope of practice for you, and then also understanding and knowing your hospital policy. And there are nurses who are also attorneys. One who I can think of that's a very good resource is Ernice, and she's at Your Nurse Lawyer. She's a very good resource for nurses who may be struggling understanding what their role is as a nurse ethically and then legally as well.
Ernice is a great resource for a lot of these cases that involve nursing in particular. And she breaks things down and also helps highlight a different way of thinking when it comes to the legality around how to protect your license, also how to care for patients, also what it means when laws are vague. And that goes into the changes after Roe versus Wade, which has also made an impact on patient care delivery. Should we talk a little bit more about the Alex Wupples case, do you think, before we continue?
I think that it's important to touch on that a little bit because she is a prime example of a nurse who ethically stood by her patient. She did not want to violate HIPAA. She knew what her rights were. She stood, she stood 10 toes down. She stood 10 toes down. And, obviously she was reprimanded for that and she was arrested for that. But I think it's important to point out that a lot of nurses might be afraid. They may be scared. They don't know what's going to happen to them if they, if they don't comply with what the police, are asking them to do.
So, just for an overview, for anyone who isn't aware of the nurse Alex Wupples case, from the Nurse.org article that was published a couple years ago, Nurse Alex Wupples was unlawfully arrested by police officer Jeff Payne on July 26, 2017, for refusing to draw an unconscious patient's blood. Police officer Jeff Payne was originally placed on administrative leave and ultimately fired a month after the body camera footage was released. And if you were on the nursing internet at that time, you most likely saw that video. And between now and then, it has resurfaced because it has been a huge point of it's a huge trigger, honestly, for the nursing community and also a huge wake-up call in what can happen when you truly advocate for your patients against an authority figure that is using their power and authority to inflict harm to get what they want. Officer Payne said that he was not sorry and planned to sue. In an interview with Fox 13 Now, he claimed that he feels he did everything within the law and the policy. Payne expressed bitterness towards how he was represented in the media, calling himself a sacrificial lamb, citing negativity about people who hate cops and claiming that he was made to look as horrible as possible to justify termination. And in 2022 to 2023, her case again received viral attention on social media platforms like TikTok and YouTube, but some of the information in the videos might be inaccurate or omitted. So this case has been monitored by Nurse.org for many years, and this article is really great because it has a lot of updates to her case. Can you imagine for a second that you have a patient who is unconscious and incapacitated, and your focus right now is to stabilize them and care for them and ensure that they are safe, ensure that they are well, and that you get them to the level of care that they need so that they can hopefully have a good outcome. And while advocating for this patient who cannot advocate for themselves, you are instead arrested because you refuse to hand over their blood, their bodily autonomy, something that could go outside of the hospital to implicate them and whatever, but that's just not your role. Your role is not to give the police the means to harm your patient. And I think that's why this case just blew up on social media. This case, Nurse Alex Wupples on some sides was demonized as well because people believe that she should have complied. And by extension, in defending that patient, she was committing a crime. But that's simply not the case. So it's really a powerful reminder that when it comes to facing authority in care, being aware, and this is why we love Ernest Williams, is our best resource and tool is the truth, right? Where if we know what our policies are, if we know what our nursing code of ethics actually says, if we know how, like, what our license protects us from, we have all the tools we need to advocate for our patients regardless of the consequences, and we are doing the right thing, right? Regardless of what the other entity does. But we should never be put at risk and physical harm by an authority figure like a police officer for simply doing the right thing in protecting our patients. But again, what matters most is us truly arming ourselves with our tools, which is the knowledge and the truth around what it is that is the right thing to do.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
Yeah. What are your thoughts, Portia?
I agree with that. And I also think it's important here that we as nurses, we realize that our personal feelings have no place when it comes to taking care of our patients. I think, your political views, your religious views, whatever, they have no space in that moment when you're caring for a patient. And I think, I live in the South, so a lot of times our personal views can affect the way we care for patients. And again, I think that's where knowing, the nursing ethics, the code of ethics, knowing your rights, knowing your hospital policy, they all come into effect when taking care of your patients. Because a lot of times we kind of cross that line sometimes as nurses because we are personable. We are, the people who our patients talk to about their lives and their family and, what they're going to do when they leave here. And sometimes we can just teeter that line just a little too much, and it impacts the care that we have for our patients.
And that really leads into the next part of this conversation, where we talk about when things get blurry, and in particular when laws are unclear. And Roe v. Wade being overturned has completely just made healthcare so much more difficult to provide life-saving care. And the patients who are being impacted the most are most marginalized. So in particular, we already have a Black maternal health crisis, but with Roe being overturned, this is going to impact Black mothers exponentially, and we're already seeing this. So we wanted to highlight another case, Amber Nicole Thurman, who was a Black mother and prospective nursing student who suffered preventable complications after a self-managed abortion in Georgia. So we want to talk about the impacts of state and federal laws and delaying life-saving care. So according to ProPublica, abortion bans have delayed emergency medical care, and in Georgia, experts say this mother's death was preventable. At least 2 women in Georgia died after they couldn't access legal abortions and timely medical care in their state. This is Amber Nicole Thurman's story. In her final hours, Amber Nicole Thurman suffered from a grave infection that her suburban Atlanta hospital was well equipped to treat. She'd taken abortion pills and encountered a rare complication. She had not expelled all of the fetal tissue from her body, and she showed up at Piedmont Henry Hospital in need of a routine procedure to clear it from her uterus, called dilation and curettage, or DNC. But just that summer, her state had made performing the procedure a felony, with few exceptions, and any doctor who violated the new Georgia law could be prosecuted and face up to a decade in prison. So while Thurman waited in pain in a hospital bed, worried about what would happen to her 6-year-old son, as doctors monitored her infection spreading, her blood pressure sinking, and her organs beginning to fail, it took 20 hours for doctors to finally operate. But then it was too late. Amber was a 28-year-old medical assistant, and she had her sights set on nursing school. She should not have died, an official state committee recently concluded. This is such a heartbreaking story, and I just want to hold space for that and pause, because Portia is a Black woman and she's a mother and a nurse, and being all of those things and knowing what it took to get to that point and knowing that needless suffering had to take place, it is so incredibly heartbreaking. And I think it's important that we begin to think about our roles in healthcare, what it means to navigate this, and how we can maybe, like Alex Wubbles, push a little further, right, for our patients when we know something is wrong, when we know that they deserve timely care, when we know that even though the law might say one thing, if a patient is declining in front of us, we know what the right thing to do is. And it's so intense. So, Portia, do you have any thoughts?
The Sonya Massey case, I think I told you, Sarah, I see myself in her. I could see that being me, struggling with her mental health, calling out, reaching for help, and then being a Black woman. And I wrote an article and I said, being a Black nurse is like being in a dual pandemic. We're dealing with being Black, you're dealing with the microaggressions that you have to deal with from your colleagues as well as your patients. And then for something like this to happen, Georgia is my next door neighbor state. Is my neighboring state. So for something like this to happen, it's just heartbreaking when, this committee concluded that her death could have been preventable. But I think about the physicians and I think about the providers and the nurses who were caring for her, thinking, their license, they're at stake. They were afraid they were going to be arrested. They were going to be charged. And so this woman, like you said, Sarah, Black women already have high maternal death rates. And, besides high maternal death rates, we already have low health equity. We already have preventable, diseases and deaths that, Black people are having to suffer with and deal with. I think I read somewhere that it said every day in the United States of America, 200 Black people die, preventable deaths. So I think that it is important, like you said, to understand the law, to realize what rights you do have, and to continue to advocate for our patients. And, going through social media, going through Instagram, going through TikTok, when this case was magnified, there were a lot of nurses who were saying, well, she shouldn't have taken what she took, but those are their personal feelings. Where does that belong in healthcare? Where does that belong when you're taking care of a patient? And that's the question I think that we have to ask ourselves every day when we go to work and we clock in to take care of patients. Where do my personal feelings and beliefs belong here right now in this setting when this person's life is in my hands?
And it's especially distressing to see those comments because you have healthcare workers blaming a Black woman for her preventable death. And one thing about it too is across federally, abortion pills are legal. So she did what she needed to do. The problem is that a legal team, I'm sure, stopped these physicians and healthcare workers from intervening to save her life. And to me, controversial opinion, one thing is if we delay care and patients suffer, our licenses are at risk, right? Versus if a patient dies, right? Our license is at risk. Those physicians, those healthcare workers, their licenses are at risk because she died, right? And they believe that just providing the procedure that would have saved her life would have harmed them.
And health equity is very important to me. And I want to make sure I quoted this stat right. And this is from Robert Wood Johnson Foundation. It says, in every 7 minutes, a Black person dies prematurely. That's more than 200 Black people a day who would not die if health of Blacks and whites were equal. That's a phenomenal number of people of preventable deaths. And you have to understand, more than likely someone's death, they had, you have to understand social determinants of health. You may say, hey, she should not have taken the pill, but you have to think about the social determinants of health. You have to think about socioeconomic factors. You have to think about all of these factors when we're talking about healthcare that contribute to decline in health equity, that contribute to someone saying, I need to do something about this, that contribute to a woman deciding that she wants to have an abortion. You have to think about all of that. And that's like nursing 101. I don't think we're taught that enough in nursing school. I don't think we're taught enough about social determinants of health. I don't think we're taught enough about health equity and how everything impacts someone's health care. Everything. This is why I say that every nurse should have to spend a year in home health care. Because when you go out there and you see someone having to decide if I'm going to take my medication or I'm going to pay my light bill, Am I going to go to the doctor, or am I going to buy groceries for my home? I think that's when you get to understand the decisions that people make regarding their health care, and we have no place to tell them what they can and cannot do unless we're giving them the resources and the tools they need to succeed when it comes to their health.
I love how you highlighted how we need to prioritize our patients' autonomy over our desire for control, because we can't control all of these systemic layers, but we can control our actions and how we respond and how we advocate for our patients. And in that, we should be aware of our nursing code of ethics and our hospital policies. So if anyone listening is looking for where to turn when it comes to this, because it can feel hopeless, we can refer to specific sections of our nursing code of ethics and our hospital policies. And we know that hospital policies often don't reflect the needs of our patients. So what are we doing to change that? Beyond being aware of these issues, we need to start taking action. And people might say, oh, it's always been this way, so it's always going to be this way. And that is not true as long as we decide to make it so, right? We can influence our hospital policies. Nurses can stand up for our professional rights and for our patients, even in high pressure situations, by using the resources available to us. And also, like, just building that solidarity with our patients, our communities, and each other. How we treat each other matters. And our constant policing of ourselves, of our patients, of our coworkers, of our colleagues, like, that allows for this kind of behavior, those authority figures to creep into our care settings. And we believe that they are doing the right thing because we are doing that to each other. We are policing each other. So it becomes normalized. So we have to do better in how we care for ourselves, each other, and our patients. Portia, do you have any other thoughts to leave folks with? I feel like you have a library of content. So if you look up The Right Nurse, you will see just so much amazing work and writing over the last how many years, Portia?
Wow, it's been 6 years,
Yeah.
I guess. Yeah, I have tons of resources on my Instagram page at The Right Nurse. Again, also LinkedIn. Sarah also has a ton on her Instagram page. She's in Scrubs. So we hope that this episode was truly insightful and resourceful and impactful for you. You can follow both of us, me at The Right Nurse, that's WRITE. Sarah is at She's in Scrubs, and also follow Don't Clock Out at Don't Clock Out, which is a beautiful organization for healthcare worker mental health, and they offer peer support groups. Debriefing the Front Lines is also another, and another one that we really love is Impact. Impact is an organization that Sarah and I both love. We were able to go to Capitol Hill with them and speak to, our lawmakers about protecting nurses and protecting patients as well. So getting involved, organizations like Impact, getting involved with those types of organizations will give you the resources and also will give you peers who are doing similar things that you're doing, people who can support you as well.
Yes, love Impact in Healthcare. They are an incredible organization, and they have so much research that they've done, and they're doing such great work putting like pen to paper to hopefully impact policy change and also get healthcare workers involved in organizing efforts. And yeah, our organization, Don't Clock Out, is a national peer support network for healthcare workers. And we're currently running a fundraiser. So if you believe in providing peer support to healthcare workers, and also acknowledging that this system is harming us all, make sure to donate to our fundraiser and also share your story with us. So if you go to our website and go to the Get Involved page and you share your story with us, we will feature you on social media.
All right. Thank you. We hope, again, this episode was impactful. We hope that you got some resources, not only from the episode, but from the accompanying blog post that will accompany this podcast. And we hope that you now have some of the tools and some of the resources to give you the confidence to advocate for your patients as well as yourself.
And thank you to Nurse.org for allowing us this platform, and hope you all have a great day.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.